All right. Good morning, everybody. It is Dr. Perlman. I hope the audio comes in clear on this video, and we are going to get right into it. I don't want to waste any time this morning. I'm going to try my best not to drag this out. So here we go. Why your peptides aren't getting you the results you want. And when we say peptides, I'm going to make this video about two different peptides, or at least class of peptides. Number one is your GLP-1 or your dual agonist or triple agonist like tirzepatide or retatrutide. Why are you not getting the result that you want while you're on this peptide? And number two, TB500 and BPC-157, but I really should have just said BPC-157 for inflammation or injury recovery. Why are you not getting the result you want on BPC-157? So let's start with the easy one. BPC-157 is probably one of the most, if not the most popular peptide. That's not a weight loss peptide. And there really isn't too much adverse reaction that can happen with these. And you really should be having a fairly good result if you're taking it for a specific thing. And what I mean by that is, I'm not going to say you should have a good result for inflammation. You should have a good result for your elbow pain. That is the most ridiculous, easy hot take that anybody could say. And that's not what I do. You have to understand that you always have to have a clear goal in mind, a clear goal. If you don't have a clear goal in mind as to what peptide you're going to use and why, it's not going to work because the flat out, it's like going into it just completely blind saying, well, I'm going to take this and see how it helps me. Peptides don't work like that. Like this is not, let me just pick a random peptide because someone said it's going to work and start injecting it or start subcutaneously injecting it, intramuscular subcutaneous, and seeing if it's going to work. So let's assume that you hurt your lower back in the gym, because I've got a lot of experience with that. So you hurt your lower back in the gym. A lot of us have done that. And you think peptides are going to help you. And you go and get BPC-157 from some place online where you don't need a doctor or a provider or nurse practitioner script. And you go and you get a powdered form and you reconstitute it. Why isn't it working? Well, number one, it's the Wild West out there with the gray market for research purposes only companies. There is absolutely no guarantee that what you're getting is, pure, non-tainted, if you will, sterile BPC 157, which then you have to make sure your bariostatic, your BAC water or your reconstitution water is also going to be, as sterile as you would like when you reconstitute it, and that you reconstitute it to the right amount based on then injecting the right amount from your syringes. When I reconstitute, I use a 3 milliliter syringe. When I inject, I use a 1 ml syringe. So I'm injecting 0.1 to 0.2 to 0.3 to 0.4 of an ml, which gives me my milligrams, whether it's 1 milligram, whether it's less than a milligram, whether I'm dealing in micrograms. It's always a lot less than maybe what you think. Now, there's a lot of content out there and there's a lot of help out there with AI of what you can use to do this, but it's still more complex than you probably think when it comes to reconstituting, and a lot of people that aren't familiar have a little trouble at first, and we learn from our mistakes. Not everybody was blessed to have a nurse practitioner wife who has been, in the ICU, post-op, family practice, up till, hormone specialist up till now, to have like tons of experience with this and just fly through and teach me over and over again. But you've got to understand that injecting can be scary, and it can also be done incredibly wrong. And if you're not perfect with your how should we say, practice, right? Practice makes perfect with reconstitution, injection, quality of needle and site, you're not going to get the best effect. And if you don't do it with TB500, which is really the next part of this video, is having a goal in mind, TB500 is the part of the Wolverine stack that takes into account systemic inflammation and the protein or actin signaling, and then the musculoskeletal repair and resynthesis on a systemic level that gives the injury a chance to heal while synergistically working with a good BPC-157 that will go to find the injured site. And when I say the injured site, it is going to be better in an acute situation, because that is what not only was it studied for, at least to my knowledge and my understanding, is that it's good for acute injuries. Because when you're dealing with angiogenesis and VEGF and sort of like bigger, better, newer blood vessels, where there is a area of blood flow, muscle, tendon, certainly not ligament, unless you're like 15 years old, you're not going to have the vascularization to warrant repair to those areas. So when we're dealing with blood flow and inflammation to go to these, areas of tissue repair, it's going to favor an acute sort of injury to drive down not just inflammation with the TB500 and the BPC-157, but synergistically working systemically and at the site together to give you the best repair. So why isn't BPC-157 working? Well, are you taking a capsular form? If that's the case, it's not going to work at the level of the muscle and the bodily injury. I'm sorry, it's just not. Bioavailability has been proven through research that it just isn't going to get utilized that way. If anything, it will actually help the ulcerations in the gut. It's making its way through the GI, so the BPC-157 will probably work for your ulcers. It'll probably work for your gastritis. I mean, probably, hopefully, allegedly. We don't know. I know there's a bunch of other supplements that I really like that are powder form that you take as a shake for ulceration, GI, upset. There's a lot of protocols that involve aloe vera, that involve zinc carnitine, that involve L-glutamine. There's a lot more products out there that really work well for the gut, but BPC-157 oral capsule, assuming it is what it's supposed to be, that could work. But the reconstituted sterile pharmacy, compounding pharmacies, I really like BPC-157 along with TB500. And yes, I get my TB500 from Peptide Sciences. I get the 5 milligram, I believe. I reconstitute with 2 ml of water, and I inject, probably less than a milligram is what, I inject less than a milligram. I like microdosing, and I think it's worked really well when it comes to inflamed, sort of like a bigger flare up on a back day. And I don't mean back day at the gym. If my back flares up, it works for me. Okay, so that's number one reason. TB500 with BPC-157, you got to figure it out. Talk to somebody about it, whatever. I just haven't had success with BPC-157, the way other people have on its own. Second reason that your peptides are not working, and now we're going to talk about the most popular GLP-1 or the semaglutide or semaglutide, however you want to say it, tirzepatide, the dual agonist, and of course retatrutide, everybody's new favorite, the triple agonist. And here's the deal. I'm going to make this really simple. So for those of you out there that want to hate, whatever, it's an open forum, free world, you can do whatever you want. If your weight loss peptide isn't working, and we're going to assume that you're getting it compounded for the first two, and the retatrutide can't get it compounded yet, but let's assume that you're using it and it's not giving you the result you want, but the purity is there. Like, you know what you're taking, you've tested it, you understand, you value, you're losing some weight, it's definitely made you less hungry. Because that is the one thing about these drugs when people say, because I know now, I've been on retatrutide for over a month, and I can tell you that microdosing less than a milligram up to capped at 1 milligram of retatrutide over the course of, it's actually been a little more than a month, it's 5 doses, once a week on a Wednesday night is when I do it. I am not that hungry, at all. And I work out 5 to 6 days a week in the gym, in the mornings at the gym, probably going to go in a minute, after this video, and do a pretty good heavy weight training, pull the sled. Cardio is very light. I really only walk for my cardio, a little bit of cycling, but that's another story for another video. And guys, you can ask me any questions you want. I've back pain, lumbar decompression surgery 2 years ago, long road to recovery, many modalities. Thought I would never run again, thought I would never be able to really function at the capacity that I wanted again, and I'm finally back at the gym, pulling the sled, going on the bike, doing all these things. So I've got a lot of insight and a lot of life experience that I want to share about that, because I almost got off track. But when it comes to these peptides and utilizing them and getting to the gym, and what I'm saying about retatrutide and what I'm saying about all these things is, your diet sucks, flat out. If you're not getting the result you want and you're not morbidly obese, because yes, if you're morbidly obese, very, very, very overweight people will lose a lot of fat, drowns out the food noise. They're going to lose a lot of muscle. They're going to have a lot of extra skin. That is a whole different conversation compared to someone like me, or maybe you out there that's a gym going 35 to 55-year-old, I don't know, I'm throwing just a range of 20 years in, that may have, love handles or soft belly, or their face is kind of round, or whatever our symptoms are, and we want to look good and we want to lose weight. You know, a lot of us guys, you know, we used to have our 33-inch, you know, suit with the inseam and the nice, you know, Jason Statham look going on. And maybe now, you know, years later, you can't fit into the 34s, you know, it's tight, love handle spilling out, and you're wondering what's going on. And maybe you just think testosterone is the answer. No, these drugs work. Tirzepatide, semaglutide, Ozempic, Mounjaro, you name it, like, they work. The question is, are you working with it? And what is your diet like? I have literally had days where I ate a little too much of a potato or a little too much of not just rice or peanut butter or something like that at a wacky time. And I've had a lot of GI upset the next day. And we're not talking like, oh, hospitalization, gastritis, and, we're having like obstructive bowel syndrome, nothing like that at all. It's just, you know, that when you're taking a drug that delays gastric emptying, when you're taking a drug that drowns out the food noise, and you're dependent on, at this point, the fact that you're going to lose muscle because you're eating less, not just in, oh, but I'm working out to counter it. No, of course. You know, there's plenty of people that are, you know, retaining muscle and getting still a good physique while using even higher doses of these GLP-1 like peptides. But their eating is tuned in. It's like dialed in. It's perfect. Excuse me. In the bodybuilding community, when they're using drugs like this, they're not just eating their 1 gram per pound of body weight. And why would that be any different for you? So instead of eating like 1 gram of protein per pound of body weight a day and saying like, okay, well, I got my 160 grams of protein for today. No, you might need like 190 to like 220 grams of protein on top of, you know, some intentional carbohydrate eating, on top of intentional resistance training, on top of still getting in some cardio, and really then seeing a difference between, you know, fat coming off the body versus kind of looking soft, not getting the result you want. Oh, I haven't put on any muscle, or I don't feel like I'm retaining any muscle, especially when you're on these peptides, the GLP-1 like peptide, at a higher dose. And really, without carrying on in this video, I could say you've got to check your diet. You've got to really track how many calories you're eating, and good calories. I don't want, like, guys, if you're out there right now saying, well, I was hungry, or I'm barely hungry, but I want to make sure I get something, so I have a lean body protein shake for my 240 calories, and then later on I had like a Kellogg cereal bar or oats and honey. I mean, that's not going to cut it. There are no good quality macronutrients going in at that point to sustain muscle building and muscle retention and bone density as you're trying to get lean and thin. Because if you're on Ozempic or you're on retatrutide or you're on some of these drugs and you're not a bodybuilder, like, literally, my message isn't even to like anyone who's a bodybuilder who has experience with these drugs, because you probably have A, more experience than me, and B, you know how much you're eating and how hard you're training. And if it's hard for you to continue to get that much food, you know, obviously that won't apply to a 160-pound, you know, guy at the office all day, me, or same thing if that's you out there. You've got to understand that that toast with peanut butter isn't going to cut it. But having broccoli with a little avocado and the extra chicken breast or the extra ground beef is the thing that's going to cut it. If you're a salmon gal or guy, or you're a tilapia guy or gal, that salmon or tilapia extra fillet of 6 to 8 ounces, or even as much as 12 ounces in a given, you know, split into 2 meals, along with some of your favorite vegetables, and maybe having a little bit of, you know, couscous or rice or quinoa, whatever, if you feel good on it, like, that's the difference between having, you know, 800 to 900 to 1,000 good calories split out, you know, 2 to 3 times throughout the day, and retaining muscle and watching fat come off, along with, again, we're talking about bone density, but all the other hormones that come into play, without you just getting, you know, very unhealthy in this bad caloric deficit. That's too much. Okay, I don't want people to think calories in, or I eat less calories and I burn more. The worst thing you can do on these peptides is reduce your calories to the point that you're also exercising and you don't even have the metabolic fuel necessary. That's right. You don't have the fuel, the food necessary for your metabolism to be able to retain the nutrients needed in your body to have working hormones. To have working hormones means have working libido. To to have working, cellular turnover and repair in terms of hair growth, bone growth. Okay, like I'm not going to go down for the rest of them. You need that because you need food and you have to have good calories. And that's why people aren't getting the result they want on these peptides. Because believe me, if you're thinking, oh, I'm not getting the result I want, I haven't lost enough weight, then you simply need to put in more time and you need to make sure that you're getting a good quality peptide and you're being monitored by a physician who understands what they're doing, or certainly by somebody who has enough experience in the field to give you the confidence and track and monitor with you, get the blood work done. Always get your blood work done when it comes to taking peptides, especially if you are someone who's tracking your macros, especially if you are someone who's worried about hormones, especially if you are someone who's on hormone replacement therapy already. Always get your blood work done. All right. Because of the third one, I went down a little rabbit hole. No need to go there. I hope this video helps. I hope that now you see why TB500 and BPC-157 together are probably going to be a lot more effective than just your BPC-157 alone. I hope that you understand the acuteness of the injury along with these two peptides, and that's where it will shine versus just trying to take it, for chronic pain. I would say if the chronic pain is exacerbated or flared up, is a good time to take it. But I certainly would, or start a cycle. I certainly wouldn't just take it every day for chronic pain, because there are better options out there for that. And then when it comes to your peptide, for your weight loss peptide, it doesn't matter if you're on the single, the dual, or the triple agonist peptide right now. It matters where you're getting it from, what your dose is, and what is your diet like when you're using them. That is everything. Still to this day, performance enhancers don't work if your performance, sucks. So if your diet sucks, why would you expect a diet enhancer to work, a nutrition enhancer to work? So I hope that makes sense. If you need anything, feel free to reach out. Of course, again, subscribe, like, share. And until next time, this is Dr. Perlman.